So this is the presentation from Mencap and the National Autistic Society. We're very, very pleased to be with you all this morning. Next slide, please. My name is Debbie Oranger, and I'm Mencap's Professional Education and Training Partnerships Manager for Health. And I'm very proud to be Mencap's project lead for this important piece of work. There is also a project lead for the National Autistic Society, but today I'm being joined with this presentation by Trevor Wright. Trevor, if you'd like to introduce yourself.
Yes, good morning everybody. Really nice to see such a fantastic turnout and people engaging with the project. I was a social worker and commissioner and the lead for the autism lead for local authority, which is where I started to notice some characteristics in myself. So I was diagnosed as autistic in my mid-50s, and then after that my daughter, who's now a teenager, was diagnosed last year. So hopefully I've got a bit of personal and professional experience to bring to the project. And I'll be talking more a bit later about some of the other things that I do in the steering group, which is one of the things that I'll be co-chairing. Back to Debbie.
Thank you, Trevor. Thanks very much. So in this short presentation, Trevor and I are just going to give you an overview of the organisations that have joined our consortium, our group, and then we'll give you a little bit of information about the inclusion of people excuse me, with a lived experience, and then a short explanation of what our training model looks like, and then finally we'll share with you some of the organisations who have agreed to receive some of our training. So next slide, please.
Okay.
So a little bit about the two lead organisations. So Royal Mencap Society is a charity that is passionate about changing the world for everyone with a learning disability. And everything we do is about valuing and supporting people with a learning disability and, of course, their families and their carers. And the National Autistic Society is a national charity for people on the autism spectrum, and of course including those people with Asperger's syndrome and their families. Next slide, please. I'd like to introduce you now to Harry.
I'd like to be with you today. I would like to be with you right there with you today, but due to the coronavirus, I'm sending this video instead. Let me tell you about myself. I have a learning disability, but don't think that it should hold anyone back. I am on the Inclusion Europe board as well as working for Mencap. Recently, I've had some very good doctors and made reasonable adjustments, but there are times when I have had trouble with reasonable adjustments and people are not always kind, which is why it's so important we change this and challenge prejudice and stigma. If coronavirus had told us anything, and it should, the NHS is not just about doctors and nurses, it's about people that work for the NHS working with the direct public, and it's about getting the right guidelines. We want to name the training after Oliver, so his name and story is never forgotten. Thank you so much.
And that's thanks to Harry. So a little bit more about our group. So we've got some fantastic consortium members, and we'll start off by telling you a little bit about Access All Areas, which is a theatre group, and all the actors within this theatre group have a learning disability and or autism, and they have been helping us write the scripts for our brand new training films. And equally important is that they will be performing in all of those training films. So that's Access All Areas. We also joined in our group by Carly Jones, MBE. Now, Carly, MBE, is an independent autism advocate, and Carly will deliver some of our training, and she will also be co-chairing our steering group. Next slide, please. We're delighted to be also joined by Jeremy Harris. Jeremy is the father of Bethany Harris. Bethany has autism and a learning disability, and Jeremy will be delivering training for us, and he's also a member of our steering group. Added to our group is also Be Well. This is a training organisation based in Liverpool, and they deliver training nationally on autism and mental health, and they will be delivering some of our training too. Next slide, please. We've also got in our group the Royal College of Nursing. The Royal College of Nursing is a UK membership organisation that represents over 450,000 nurses, and we're also delighted to have Edge Training working with us. This is a training organisation that specialises in training for health and social care staff, but very specifically they work around areas of the law, which would include, for our training, supporting us and guiding us with the Mental Capacity Act and the Equality Act and the Human Rights Act. I'm going to hand over to Trevor now, who'll tell you a little bit more about another consortia member group. Trevor, over to you.
Okay, thanks, Debbie. Yeah, my main role is with Insight Autism, which is a community interest company which is led by autistic people. We have two directors and we are both autistic, and we've both got autistic children. My history, as you've just heard, is in social work and commissioning and contract management. But Nikki, who's the other half of Insight Autism and who's on the training group of this project, is also a science teacher and a research assistant at Nottingham Trent University. So we formed in 2016, because we were both dissatisfied with kind of the level and quality of autism training. And in the last 4 years, we've delivered training for Nottingham City Council, Nottinghamshire Police, museums, literacy volunteers, libraries, right in East Midlands, and Morrison's supermarkets. So we think that we can bring some experience and autistic-led views to the Oliver McGowan project training. Next slide, please, Sarah. So I mentioned the steering group earlier, and the steering group will oversee all aspects of the National Autistic Society and Mencap consortia for the Oliver McGowan project. The steering group will be chaired by experts by experience, so Carly Jones and Jez Harris will be two of the co-chairs with me. There will be other experts by experience on the group, both people with a learning disability and autistic people. And we've asked that whatever the group numbers end up being, and we see that the steering group will need to have project managers from the various partners on. But we've asked that the majority of people on the steering group will be experts by experience. So that steering group will vet all of the materials that will be used in the training, so both the training materials and any videos. And we've currently got the tier 1 training materials already completed by the training group, and we have scripts for the films. So the first task for the steering group when it gets together in March will be to analyse and vet those training materials that will be used in the face-to-face training. So that's all about the steering group. Back to Debbie.
Thanks, Trevor. So next slide, please. So just giving you a little bit of an overview of what our training looks like. And as already previously mentioned by other consortia partners, of course, Oliver's story is always going to be at the centre of our training. Next slide, please. So with that in mind, our training will start with a Training the Trainer programme. So this is a 2-day course, and it's for people who have a lived experience, and also for people who do not have a lived experience. And that's because people will be working together with and without a lived experience, as Trevor says, to deliver the training. And what's really important about this Training the Trainer is to make sure that those that are sharing the training with recipient sites have the knowledge and the skills, and importantly, the confidence to be able to roll out this important programme. Next slide, please. So we have a very simple design module. So if we look at the autism module, we have Tier 1 and Tier 2. Tier 1 is a half-day session, and Tier 2 is a full-day session. And people that do Tier 2 will also have to do Tier 1. And this is exactly the same for learning disability. So we have a separate module for learning disability, again, a half-day Tier 1 and a full-day Tier 2. Importantly, both our autism and learning disability modules will include information about people that have both learning disability and autism. Giving you an overview of the course content, we're following everything from what learning disability is and what autism is and how that affects people, and how to see invisible disabilities, and obviously reasonable adjustments, and importantly, addressing people's attitudes and behaviours. So who will we be delivering the training to? So far, we'll be covering across England organisations that include the following. So we've got interest from University Hospital Derby and Burton, Norfolk County Council, Mencap services for social care in the north and the south, St Bart's NHS Trust, Liverpool Primary Care Services, and Voyage Care. That just gives you an indication of the recipient sites. So that's us from Mencap and National Autistic Society, and with thanks to my colleague Trevor for joining. We finish off just letting you know that we're intending to deliver our training somewhere between June and November, and this is just purely navigating the challenges of delivering face-to-face training within the coronavirus setting. So thanks, Trevor, and thanks everybody for listening.